say about infertility. Infertility is defined by inability of a couple to conceive after having regular and unprotected intercourse for a period of a year. Infertility is quite common, and we discuss it in terms of a couple's infertility, not in terms of an individual's infertility. And this is for the reason that it's because it takes two to conceive, and there are several factors that can be responsible for infertility. Most couples will be able to conceive within a year. A few will need a little bit of extra time, an additional year. So we have about 10% to 15% of couples who will not be able to achieve conception even after having tried consistently for about 2 years. There are several things that could be responsible for a couple's inability to conceive, and these factors could be specific to the male, they could be specific to the female, and then they could also be a blend or a combination of factors found in both the male and the female, of the couple. The male factors and indeed the female factors range from things that are present even at birth, like genetic or chromosomal abnormalities, which will render either of the couple infertile, unable to produce spermatozoa or ova, depending on which partner we're discussing. It could also be a result of structural congenital abnormalities, either of the male reproductive tract or of the female reproductive tract. These are fairly uncommon. More commonly, factors that are responsible for infertility include things like infections, and this can actually be infections which are contracted even in childhood. For instance, the mumps virus, the virus that causes mumps infection, can cause inflammation of the testes even in childhood, and this can lead to infertility, which may not be discovered until much later. Other infections include sexually transmitted infections, which are particularly known to cause infertility in females because they go ahead to block the fallopian tubes, which transfer or transmit the ova from the ovaries down to the uterus. So in addition to infections, hormonal imbalances can also cause infertility, and these are fairly common and are also correctable. Infertility can be extremely distressing for a couple, and fortunately advances in technology have ensured that most couples will be able to achieve conception with intervention. So once a couple has been diagnosed as infertile, it's better to treat them together. So it's advised that the couple attends the clinic together. Now this is important because, like I said, there are male factors, there are female factors, and there is also an overlap of both factors. During the investigation period, the male partner is usually investigated first, and this is because it's usually very easy, straightforward to assess a male for causes of infertility. Now once it has been identified that the male is okay and doesn't require further treatment, then the investigation moves on to the female, and this can be extremely extensive and in some cases a little bit invasive. Now once the cause of infertility has been decided, then treatment goes along the line of the identified cause, and the treatment can be as simple as counseling on the fertile period or the fertile days, whereby the couple ensures that they engage in unprotected intercourse during the fertile periods. It could be something as simple as ovulation stimulation, or drugs, other medications or drugs to adjust an imbalance in hormones, and this could be either in the male or the female. There might be the need for surgical intervention, especially if conditions such as varicocele have been identified in the male to be the cause of the infertility, or other tubal blockage in the female might require some surgery to ensure that the tubes are patent, and other surgical procedures also exist. Now, if these fail, then we have assisted reproductive technology methods that are available and which are effective. These range from intrauterine insemination of sperm, either with the male partner or even with a donor, all the way to in vitro fertilization using the ova and the sperm of the couple or of donors as well. Now, this tells us that infertility, though distressing, in a couple, does have there are treatments available, and these have been found to be extremely effective. The important thing is to identify the cause and direct treatment accordingly. Thank you.